Should I use sleep medication? A lot of people nowadays depend on sleep medication to get them through the night. And while that might seem like a pretty straightforward fix, it's important to know how unhealthy they are. First, sleep medications were never intended for long-term use, and although they were made to be short-term solutions, even short-term use comes with many dangers. One of the most prevalent negative impacts of sleep aids like benzodiazepine hypnotics and Zopiclone is the hangover effect. This phrase describes undesirable side effects such as tiredness, balance issues, poor motor coordination and memory, or cognitive problems. 80% of people who use prescription sleeping pills say they experience at least one of these adverse effects the next day: weakness, diarrhea, nausea, gas, headache, constipation, changes in appetite, dizziness, balance issues, shaking, nightmares, strange dreams, stomach pain, drowsiness, dry mouth, sleepwalking, shallow breathing, a decrease in cognitive ability the following day, and difficulty remembering or focusing. A frequent user of sleep medications can quickly get accustomed to the drugs, and then they become less effective than before. This can also result in dependence, meaning your body is so used to you taking the pills that falling asleep without the drugs become even more challenging than before you started using them. Withdrawal is also possible if you stop using them suddenly. This means you can experience uncomfortable symptoms, such as shaking, sweating, and nausea. Now, some people mix sleeping medications with alcohol, which is a sedative in and of itself. The pairing of these two poses a severe risk, since it could cause your breathing to become so slow that it results in death. Parasomnia is a type of sleep disorder that causes unnatural physical occurrences or experiences that keep you awake at night. Parasomnia can happen before, during, or right after waking up from sleep. If you suffer from parasomnia, you might act strangely, move and talk abnormally, or express your emotions in odd ways. Sleep talking, eating, driving, and walking are the parasomnias most frequently linked to sleep aids. Increased dosage may make these behaviors more frequent. According to a research review published in 2018, hypnotics are connected to major illnesses and untimely deaths from cancer, serious infections, mood disorders, accidental injuries, suicides, and homicides. 2 additional studies have connected zolpidem use to suicidal behavior, perhaps during sleep too. Some groups of people are at a higher risk of developing certain side effects. Those groups include people with liver or kidney diseases, pregnant or breastfeeding women, older people, people with chronic lung conditions, asthma, emphysema, chronic obstructive pulmonary disease, etc., and people taking other drugs that can negatively interact with sleeping pills. If you experience any mild or severe negative side effects, talk to your doctor as soon as possible. They might recommend a lower dose, an alternative prescription, or a strategy for gradually weaning off the drug.